In this video, we will review the important aspects of interpretation of normal awake EEG. Specifically, we will briefly review some of the technical aspects that are important for the recording of routine EEG. We will also review some of the elements of a normal alpha rhythm, and we will briefly review some other normal variants. It is best to look at a routine EEG first by taking a careful look at the first artifact-free page. Here we can see a small amount of artifact in the back of the head at P7, but other than that, this page is relatively free of artifact and is a good starting point. In many ways, you can generate a preliminary EEG report by looking at a single artifact-free epoch. In this case, we are looking at a 10-second sample of normal wakefulness. Subsequent epochs simply serve to modify this report, changing your interpretation of what you have already described before. Many novice EEGers make the mistake of forging ahead without looking carefully at a single epoch of EEG, and in this way much information is missed. First, we will start briefly by looking at the technical aspects of this EEG. In this EEG software, the technical parameters can be seen in a bar at the top of the page. You can see that the low frequency filter is set to 1 Hz. This is reviewed in much greater detail in a previous video, but this is an appropriate level for looking at normal wakefulness. You can see that if we toggle this menu, there are many other options which can dramatically change how our EEG looks. The high frequency filter is set at 70 Hz, which again is appropriate for normal wakefulness. Importantly, the notch filter is off. As mentioned in a previous video, having the notch filter off is very important so that you do not miss electrodes that may have abnormally high impedance and therefore are not connected to the head. By having the notch filter on during initial recording, you may be missing important data about the technical quality of your recording. The sensitivity here is at 7 microvolts per millimeter. Increasing the sensitivity can give the impression that this recording is abnormally high voltage. Similarly, decreasing the sensitivity can give the false impression that this patient has a low voltage recording. The normal sensitivity for reading adult EEG is generally 7 microvolts per millimeter. You may have to adjust the sensitivity in children who generally have a higher voltage EEG background. Finally, we look at the time base, which in this case is set so that we see approximately 10 seconds in a single epoch. You can see what happens if we change the time base to increase the number of seconds in a single epoch. The background seems abnormally high frequency or fast. Next, we have to look at the montage. This is an anterior-posterior bipolar montage, which is a common montage for reading routine EEG. We have discussed some of the strengths and weaknesses of montages in a separate video, and I would refer back to this for additional details. To review briefly, we start with left temporal, then left parasagittal, then midline, then right parasagittal, then right temporal, and a single EKG recording. As we become more advanced in our EEG interpretation, we can change the montage settings to suit our specific needs. Now that we have carefully looked at the technical aspects and reviewed the montage, we can begin to identify and interpret the alpha rhythm. On this epoch, you can see that there are 3 main segments. I would focus your gaze towards the posterior aspects of the head. You can see that there is a relatively high frequency oscillating pattern, which is then interrupted for the middle 4 seconds, and then re-emerges. This is the alpha rhythm. We have reviewed eye movements in a separate video. Here we see a large upward deflection, or negative polarity, at the front of the head in FP1 and FP2. This would suggest that the eyeballs with their positively charged cornea are moving downward, and this is actually eye opening. The high-frequency activity in the back of the head, which is the alpha rhythm, has been blocked with eye opening. Here, later in the recording, we see a large downward or positive deflection. And in this case, this is due to eye closure with Bell's phenomenon and the positively charged cornea moving up closer to the forehead. You can see that the alpha rhythm re-emerges with eye closure. The characteristic of the alpha rhythm which makes it augment or become higher voltage with eye closure and attenuate or become lower voltage with eye opening is known as reactivity. Therefore, we can report that in this recording we have a reactive alpha rhythm. Next, we will look at the frequency of the alpha rhythm. The best way to measure the frequency of the alpha rhythm is by looking at 1 second of artifact-free recording with the eyes closed, as I have outlined here. Looking carefully at this segment, we can see that the frequency is 11 Hz, and we have our second characteristic of the alpha rhythm. This is a histogram showing the range of alpha frequency on the horizontal axis and the percent of normal subjects with this alpha frequency on the vertical axis. You can see in this study that more than 95% of normal subjects have an alpha rhythm that lies within the range of 8.5 to 12. Therefore, an alpha rhythm would likely be considered abnormal if it was below 8.5 Hz or above 12 Hz. After looking at the frequency of the alpha rhythm, we can explore its amplitude. As I have discussed in previous videos, there are no absolutes in EEG, as we are always comparing the signal at one position to the signal at another. Therefore, we can never get a completely accurate sense of the amplitude. However, in general, the amplitude seen on a referential montage gives a much better sense of the absolute amplitude in any particular head region in comparison to the amplitude on a bipolar montage when we are looking at the differences between adjacent electrodes. Therefore, on this EEG, we will switch to the average reference montage and review the amplitude of the alpha rhythm using this montage. As well as switching the montage, I have also inserted a scale legend which we will use to estimate the amplitude of the alpha rhythm. Here I have placed the scale legend next to the O2 channel and will measure the amplitude by looking at the total deflection from lowest point to highest point. In this situation, the deflection from lowest to highest point takes up approximately 1/3 of the scale legend, which would mean that the amplitude of this alpha rhythm is somewhere between 40 and 50 microvolts. The normal amplitude for an alpha rhythm in an awake adult is between 20 and 50 microvolts, and so we can say that this patient has a normal voltage alpha rhythm. Thus, we have been able to add one further characteristic to our description of the alpha rhythm, in that it has a normal voltage between 40 and 50 microvolts. It is common for the amplitude of the alpha rhythm to vary throughout the recording, and so in the report I would recommend outlining a range of amplitudes in which the alpha rhythm most often fits. Next we will look at the symmetry of the alpha rhythm. To do this, we have to shift our scale legend to the left hemisphere and measure the amplitude of the alpha rhythm on the left. Here I have put the scale legend adjacent to O1. You can see that if we measure the amplitude from the lowest to highest point on the waveform, it takes up approximately 1/4 of the scale legend. Therefore, the amplitude is approximately 30 to 40 microvolts. Going back, now we have a sense of symmetry. The amplitude is between 30 and 40 microvolts on the left side and between 40 and 50 microvolts on the right. In general, we say that it is still a normal level of asymmetry as long as the difference in amplitude is less than 50% on a referential montage. As well, the amplitude of the alpha rhythm is generally higher voltage on the right side compared to the left. Although there are several theoretical explanations for that, there is no conclusive evidence to explain why this is the case. As with the amplitude, the level of symmetry can vary from epoch to epoch. Therefore, it is important to look at the entire recording before making any definitive conclusions about asymmetry. Now, we have a fourth characteristic of the alpha rhythm that we can add to our report. The alpha rhythm is reactive, it has an 11 Hz frequency, the amplitude is between 30 and 50 microvolts, and there is a normal degree of asymmetry. The right is the higher voltage than the left, but this is less than 50%. One final component of the alpha rhythm that we should comment on is its distribution. In general, in a normal adult, the alpha rhythm is maximal in the posterior head regions, particularly the occipital electrode contacts. We can see that this is the case in our patient. In some cases, the alpha rhythm is termed the posterior dominant rhythm for this reason. Therefore, based on a careful look at a single epoch of routine EEG, we can obtain a huge amount of information about the alpha rhythm. Here are a few other characteristics of the alpha rhythm. It is, as we said, between 8.5 and 12 Hz in most individuals, and an alpha frequency less than 8 Hz throughout an entire recording would be considered abnormal. The alpha rhythm is generally constant within an individual. There can be some variability. It can slow down by as much as 1 Hz during drowsiness, and it can slow down with older age. The alpha frequency generally increases in frequency through childhood and reaches peak frequency in adolescence or early adulthood. Finally, we will conclude our discussion of normal awake EEG by focusing on 3 common normal variants, called alpha squeak, mu rhythm, and lambda waves. First, we will look at alpha squeak. We will remain on the same epoch of normal awake recording that we have been analyzing throughout this video so far. Focus your attention on the second half of this video with the second instance of eye closure. Initially, for the first 0.5 to 1 seconds after eye closure, the rhythm in the posterior aspect of the head is much faster than the normal 11 Hz alpha rhythm. It is approximately twice as fast before returning to the normal 11 Hz baseline. This is called alpha squeak. This name dates back to the era of paper EEG recording. At that time, EEG was recorded on paper with multiple pens being deflected at the same time. If the pens were deflected up and down very quickly, secondary to a high-frequency brain rhythm, they would generate a squeaking sound as they moved across the paper. Hence, alpha squeak. I have chosen an epoch of awake EEG from another patient in order to better demonstrate lambda waves. You can see that this EEG epoch is organized in an anterior-posterior bipolar montage. And if we look at the state, there are a couple of clues that this patient is awake with their eyes open. One clue that the patient is awake is that there is prominent myogenic artifact in the frontal and temporal regions, suggesting active muscle tone in the facial and jaw muscles, which is more prominent during wakefulness. In addition, we see numerous eye blinks, which would suggest that this patient has their eyes open and is blinking. The lambda waves can be seen throughout this epoch in the posterior head regions, shown here. If we look more carefully at these lambda waves, we can see that they are fairly simply configured with 2 phases. Therefore, we would call them diphasic. Superficially, they resemble a Greek letter lambda, which is how they get their name. Second, we can see that they are maximal in the back of the head. Third, we can look carefully at their polarity. Again, we see that there is an initial upward deflection at P701, P301, P402, and P802. Going back to our polarity rules, this would suggest that these waveforms are either electronegative at P7, P3, P4, and P8, or they are electropositive at O1 and O2. Because there is no evidence of these waveforms more anteriorly, the most parsimonious explanation is that these are electropositive at O1 and O2. To convince you further, I have switched to an average reference montage, and you can see that these waveforms now have a downward deflection in the O1 and O2 channels with reference to the rest of the head. This provides further evidence that these are electropositive waveforms. The exact generator of lambda waves is not completely understood, but they are generated by inspection of complex visual patterns. During routine EEGs, lambda waves are often generated by inspection of the dots on a ceiling tile, for example. In our experience, during video EEG recording on inpatients, we often see lambda waves when patients are examining complex visual patterns on computer laptops, for example. Regardless, lambda waves are most prominent when the eyes are open. I have moved forward in this recording, and we still see some lambda waves. But if we move forward one more epoch, we can see that this patient slowly closes their eyes, and the alpha rhythm emerges in the posterior aspect of the head, replacing lambda waves. Therefore, we note that lambda waves are blocked by eye closure. Let's go back to our original patient and choose another epoch to look at carefully, this time focusing on the last element we will discuss in this video, the mu rhythm. Here we have another example of an awake recording, again a clue being the prominent myogenic artifact in the frontal and temporal regions. We can also see that this patient likely has their eyes opened, as we have prominent blink artifacts. We do not see much of an alpha rhythm, which is not surprising considering this patient's eyes are open. What we do see in the parasagittal region, particularly on the right side, is a rhythm that is maximal at C4. Let's look at this more carefully. This is the mu rhythm. We can see several characteristics of this rhythm. First, it has a very prominent arch shape. This superficially resembles the Greek letter mu, and this is how it gets its name. Next, we can look at the frequency. In this case, the frequency is approximately 10 or 11 Hertz, or very close to the alpha frequency. In general, the frequency of the mu rhythm is very similar to the alpha frequency. The mu rhythm is thought to be generated by the sensory motor cortex at rest. Interestingly, the mu rhythm is most prominent when the patient has their limbs at rest. The mu rhythm can be blocked by movement of the contralateral limb, or, interestingly enough, even by a thought of moving the contralateral limb. Mu rhythm is often seen on one side or the other, and can be seen synchronously in both hemispheres. The mu rhythm is generally more prominent when the patient's eyes are open, possibly because the alpha rhythm blocks the mu rhythm during eye closure. This concludes our review of the Normal Awake EEG. We have looked at the technical aspects of Awake EEG, normal alpha rhythm, and some other normal variants. In subsequent videos, we will look at normal sleep, other normal variants, and then some abnormalities.